afternoon. We discuss different topics in plastic surgery, and I get to answer your questions. Today, we're going to be talking about the fluff fairy. Is it real? So we'll discuss a little bit about what is the fluff fairy and why do people talk about this, what is really going on in the buttock so you understand it's not a fairy, but there are some changes. There are some changes that you're going to see usually at 3 to 6 months post-op, and that's why people talk and mention it as a fairy, okay? It's not going to happen overnight, so don't expect it to be like the tooth fairy, but there are things that are going to change, okay? So I'll divide it in different things that are going to be changing, and then I'll get to answer your questions, okay? So let's start with skin elasticity. So at first, when we're transferring the fat, okay, and this fluff fairy, so everybody's on the same page, we're talking about a BBL, okay? Liposuction and fat transferring to the buttock and hip areas, okay? So when I first transfer the fat, the skin needs to stretch, right? To allow the fat to be put in there. And this happens in 30 minutes when I'm injecting the fat. So that means the skin has a limit of how much it can stretch, allowing me to transfer that fat. At first, that skin is gonna feel super tight, okay? It's gonna feel like it's gonna explode. So that is very common that you feel the first few days after surgery super hard. The buttock feels hard, tough, even high, okay? That skin takes time to kind of stretch, and with time, it doesn't stretch to the level that it's gonna drop, but it stretches to the turn that it's allowing that fat to settle and to become part of the buttock. So it softens because the skin is not longer so tight. The skin cells has like relaxed, allowing that fat to settle in and feel more natural, okay? So it's a process, so don't be scared if you, right out of surgery, touch your buttock and don't feel it, it's numb, it's hard, and it doesn't feel like part of your body. It needs time for that skin to stretch to allow that fat to settle, okay? So this is one of the first things that is gonna change, giving you that illusion of the fluff fairy, okay? The fluff fairy, what is it? It's basically what people are expecting is that the buttock softens, that it increases in size, and that it jiggles or it moves, right? It becomes soft. It's not like two rocks, okay? So the first component is skin elasticity. How long does it take? All of this changes, all of it that I'm going to be talking about, it's a process. So don't, like some people say, oh, at 6 weeks I'm going to see a fluff fairy, or at 3 months I'm going to see it. And they expect that at 3-month mark, where is it? It's not like that. It's a very slow process that if you put pictures right next to each other and at 6 months you compare them, you're gonna see a big difference. But from one day to another, you're not gonna notice it, okay? So it's a very slow process that's why we mention all the time, trust the process, because it is. So you have to leave time for your body to heal and all of these things changing, okay? Swelling. Swelling is gonna make a big impact in the shape and also the texture and the softness of the buttock. At first, the skin is tight. It's all swollen, so it's gonna be hard, numb, and the shape is gonna be different, okay? You're still swollen from the lipo, so your waist is wider than it's what's gonna be. And the hips look like tight because it's still swollen, okay? The swelling tends to go down by 6 weeks, but still, this hasn't kicked in, okay? The stem cells and the viability. So it's very common for people or patients to freak out and get scared that at 6 weeks they have lost the BBL. It's not that. The swelling is down, but the fat cells haven't grown, okay? So you're in a place that you still have to give time for your body to continue the healing process to see that fluffing effect or that final result, okay? So swelling, majority of time at 6 weeks, but it lingers, okay? Like I said, it's not gonna be one day to the other. It's gonna continue, and it doesn't go down linearly. It goes down like up, down, and when you see the final end, yes, it went down, but in the days in between, you may have days that you're more swollen, and that fluctuates, okay? Fat viability. The fat that I'm transferring to the buttock and hips needs to grow new blood vessels. And people say, I don't understand why you can't sit if you were sitting before and you had fat in your buttock before and it's not dying, like whenever I sit, my fat is not dying. The reason for that is because the fat that is in your buttock has blood vessels, right? It's like a tree that has its roots, and the roots are providing the nutrients for the tree. But if you get a tree and you plant it in a new area, those roots need to grow, okay? And that time, it's the same thing. It takes time for those roots to grow and that fat to get new blood vessels. In that time, so usually that's like 6 weeks, right? So in that time, the fat is surviving from the nutrients that is absorbing around it. If you put pressure, the fat doesn't have that ability, okay? You're killing the nutrients around it so it can absorb and the fat can die. The fat we always are going to lose some fat, okay? And that's in that process, that viability survival process of 6 weeks to 3 months, you're gonna see a decrease in by 20 to 30%. So again, that adds to the effect that you're seeing at 6 weeks. The swelling went down, then the fat cells that died are dying at that time, so the buttock may look smaller than what it was and what your goal is, okay? But don't get discouraged because the stem cells are still there, okay? What are stem cells? Stem cells is the cells that are pluri and multipotent. So they have the ability to grow and mature. So those stem cells are there in our fat, and that is transferred when we're transferring. When we remove the fat with the liposuction, that fat with its stem cells that are in our fat normally, it's been transferred. That fat is a small stem cell, but has the potential to grow into a mature adult cell that has the ability to grow when your nutrition is in high fats, grow in size. And that's what the fluffing is, okay? So that fluffing is mainly the combination of the skin relaxing and then those stem cells, if you continue with your diet and your good post-op care, those stem cells growing and giving you that effect of that fluffing, okay? So when do you see it? 3 to 6 months, sometimes a little bit longer. If you lose weight, then those cells are gonna decrease in size, okay? The fat cells in our body, we are born with a certain number of fat cells, okay? Even if you double your weight in size, your body's not creating more fat cells. It's just increasing the size of the fat cells that you have, okay? So the number of fat cells that have been transferred at 3 months, that's it. Those fat cells survived. Usually, like I said, you lose 20 to 30% of the fat that's been transferred, but once at 3 months, that's it. Those are there. They become part of your buttock, okay? So that's another question that I get a lot. Are BBLs permanent? So the short answer to that is yes. I mean, that's your fat. This is not something that your body's gonna absorb, that is gonna disappear, but fat and skin ages, okay? We live with gravity, okay? We're aging, our cells are changing. So the number of cells are gonna still be there, but there's gonna be aging changes in our body in head to toe, okay? And our buttock is not a spare part, okay? So the short answer is yes, it's permanent, but the longer answer is you have to keep up with your lifestyle changes, with your diet to maintain those results, like anything, okay? And that fluffing and that increase in size is gonna continue to fluctuate with you, okay? So like before, if you gain weight, your belly will increase, and if you decrease, and if you diet and exercise, your belly will flatten. The same way your buttock will behave. If you gain weight, then those cells are gonna increase, and you're gonna see a bigger change in the volume in your buttock and hips. But if you keep your weight, then you're gonna maintain your results long term, okay? So you guys tell me if it's real or not. That's the scientific explanation. I hope that you understood a little bit, and I'll get to answer your questions now.
So, since I have a blood clot over 10 years ago, will I ever be a good candidate?
So unfortunately, it depends on your surgeon. I do not perform elective procedures like a BBL, liposuction, mommy makeover in patients with history of blood clots, okay? So there are different things that put you at increased risk of blood clots. One is genetics, which you already have that genetic predisposition for blood clots. The other is hypercoagulable state, so surgery it is, and immobility, which is traveling and post-op care. You're not going to be moving the same way. So if you already have the genetic, those two we can modify and try to decrease the risk post-op. But if you already have the genetic, you have the 3 strikes. And I think the risk of blood clots with a potential embolism and being fatal, I don't think it's worth it.
Okay. Do you recommend post-surgery IV therapy at home?
IV therapy at home, it's up to you. I don't think it's for everybody, but there's some people that benefit from it. Good candidates can be post-bariatric patients that can't really tolerate a lot of fluid, because I do recommend that you take at least 1 gallon of fluid a day. So there are a lot of my bariatric patients that are like, my stomach is just too small, I can't tolerate it. If that's the case, you may consider adding IV afterwards. But for every single patient that decides to get IV home therapy afterwards, you still need to try to drink that gallon of fluid a day. Anything that goes through the vein, you pee it very quickly. So that hydration is going in and out, okay? So it's gonna make you feel better for a short period of time. In 2 to 3 hours, you're gonna pee it and you're gonna be back to square one.
Can you do body tight in areas that you don't do lipo, only for skin retraction?
Yes, that's a possibility. So it depends on the area that it is, but it is an option. I usually combine it with liposuction because if there's an excess thickening in the subcutaneous space, that you're going to see a major difference in the contouring. But body type can be done without the need for lipo.
Do you perform ab etching? How realistic is this process?
Ab etching I do, but it's for very strict, I'm very strict with my indications and who I perform it with. What's ab etching? Ab etching is doing more liposuction in one area and trying to define or create shadows that appear as muscle shape, okay? So for example, you do more liposuction in the area of the middle line to create that linea alba or that definition between the ab muscles. You do a thinner, more definition on the obliques so you can create that triangle that looks more athletic. And all of that is great, but you need to maintain your weight. If you increase weight, then your differences in thicknesses are gonna change, and then you're gonna see that the area that I left more fat to create that definition is gonna get thicker. And the other thing that is very important, your skin quality needs to be perfect because it relies on your skin basically retracting all the way and attaching to your muscle, so you see that shadow. So if you have skin laxity, you're not a good candidate for the procedure. So I do it, but for very good candidates, and needs to be for people that are committed with their post-op to maintain their results.
Okay. Can I do 3 procedures at the same time?
Depends, okay? So I am not doing a facelift with liposuction and thigh lift, but the most common one that I do is this is a Dr. Earl term, the trifecta perfecta. It's a mommy makeover, so breast and belly with brachioplasty. So that's the most common 3 procedure that I do. But if you're thinking about like minor areas, for example, BBL with arm lipo, shin lipo, that can be combined and stuff like that. So it depends on what are the 3 procedures, and depends what's basically the decision is anesthesia time and the recovery that one procedure doesn't interfere with the other.
This is not a question, it's a piropo. I don't know how to say. It's a and I love it. She said, I don't know, how are you looking younger and younger?
Oh my God, I know who has this question. And I can say that hydration and I do that too. But I think, adding other things, right? I'm very strict with my afternoon and during the night, my skincare routine. my moisturizing, my SPF. I use vitamin C as an antioxidant to improve skin quality. I use my hyaluronic acid topically, so all those things are extremely important. Hydration, and also I did Morpheus. Morpheus is great for skin quality. I'm 2 treatments in. I did it in my face and neck. After the second treatment, I see a major difference, and my next treatment is coming up. I think it's next week or the following. I think it's in 2 weeks. My third one. So it's 3 treatments, 1 month apart. So I've seen a big difference. So I can say other things, but Morpheus also.
Okay, how much retraction can I expect with body tight in arms and thighs?
That depends a lot in your skin quality and the severity of your skin laxity. For people with severe skin laxity, I don't think it's worth it. The Morpheus or body type radio frequency energy devices are designed for mild to moderate skin laxity to see a result. So if you have severe, then it's better to do an excisional procedure, like a brachioplasty, tummy tuck, depending on the area, to get a better result. But if you're in the mild to moderate, you will see a 50% improvement. That's the more or less the percentage of improvement when just doing lipo versus lipo and the radio frequency energy device.
Okay, I think this question will clarify a lot of doubts about Morpheus and what body type is, because
Yeah.
she asked, can we add Morpheus to the body type procedure?
That's a very good question. So they're both the same machine, but the difference is the depth of the device working, okay? So with body tight, I have to make so that's why I combine it with liposuction, because it's the same incision as with the liposuction, and it's a cannula that I put in the subcutaneous space. So the radio frequency is in the subcutaneous space. So it targets the fibers, the collagen fibers in the sub-Q space that are deeper, okay? The Morpheus is done in the clinic side, and it's done through the skin, okay? So it targets the collagen in the dermis, in the skin level, okay? So when comparing both, they act in different fibers. So, I mean, in the long term, you could combine them, but I don't combine them at the same time. I think it's too much energy to combine at the same time. There are some areas that, for example, for ab etching, they're starting to use it in the areas that you want deeper involvement for Morpheus in those areas, and I think that's a good alternative. But in general, if you're doing skin laxity, for example, the thighs or the arms, then if you're going under, I think body tight is a better alternative. But if you're not going under and you want to do it in the clinic side, Morpheus is a great alternative.
I'm looking to get a BBL, but how's it possible to not sit for all 6 weeks? What about driving or using the bathroom?
Yes. It is possible because hundreds and thousands of patients do it. So it is, but it takes planning, and it takes patience and determination, okay? So you are gonna feel tired, and there are gonna be times that you want to sit, just use your knees, rest like that. For the bathroom, a lot of my patients use like a folded towel to put under the thighs, or the other way around. So if you're gonna sit, you sit towards the toilet, and so your buttock is not in the toilet. It's more on the anterior side of the toilet. Driving, you can start driving 2 weeks post-op with a BBL pillow. Again, it takes time for you to adjust your seat, your position to drive safely, but a lot of patients do it, and it is possible. Awesome. So thank you so much, you guys, for all the questions. I hope this helped answer this fluff fairy dilemma. And I want to remind everybody that we have a Mother's Day special that is great, amazing. So for Mother's Day, we are doing a promotion that is 10% off any procedure if you book this week, okay? So, yes, go.
She's not on camera.
So if you book this week, you're gonna get 10% off any procedure, okay? Plus if you book on the month of May, you are gonna get 50 units of Botox for free, okay? So again, this week, 10% off any procedure. For the entire month of May, if you book with us, you'll get with your procedure 50 units of free Botox. But if you're doing it this week, then you'll get both. You'll get the 10% off plus the 50 units of Botox, okay? So give us a call, don't miss out. We moms need some pampering and some love, so take advantage of it. And the wait is over, okay? We've had some issues with our legal department regarding our cruise for Valentine's Day offer. We needed to check for HIPAA compliance, patient privacy compliance, which was the best way to do it. So the best way is going to be, I am gonna pick up a name here in the live, but I'm not gonna say the name, okay? So I'm gonna pick up the little name, and if you had surgery in February, check your Clara today, because the person that I pick up is going to a cruise for 2, okay? So check your Clara. Let's see, I'm not looking, and it's tiny, I can't read it. So I have one little paper, and this is it. I'm gonna give it to her, and
she's given to me.
Yes, I don't know the name. The name's there. Okay.
Yeah,
So check
ID.
if you had your surgery in February. Check your Clara, because you may be going for a cruise. Okay. Thank you guys. I'll see you guys next week in Tuesday Tips. Have a beautiful week.